Let's begin with the procedures that were shocking and work our way toward the ones that were absolutely insane. Number 10. Haircuts. You might wonder how something as harmless as cutting hair could earn a place on this list. It wasn't the method of cutting, there were no bizarre rituals or revolting tools involved. Instead, what made medieval haircuts disturbing was how deeply they were tied to social identity. Hairstyles worked like class badges, and everyone knew which cut belonged to which group. If a peasant dared to ask for a nobleman's hairstyle, he wouldn't be given a fashionable look. He'd be committing a social transgression. Haircuts determined status, visibly and immediately. Let's explore some of the strangest styles. The tonsure, worn by monks and religious men, involved shaving the top of the head while leaving a ring of hair around the edges. It symbolized humility and dedication to faith. The Norman cut was a practical hairstyle adopted by soldiers and knights, designed to make wearing chainmail and helmets less painful. The high bowl cut, far more dramatic than the childhood version many of us endured, was trimmed high above the ears. It was so widespread that it became one of the few hairstyles worn by multiple social classes. Other styles included the medieval bob, the beaver tail, the zazzera, the exaggerated big boy bowl cut, and the bald cut favored by those struggling with lice. Hair was not only fashion, it was medicine, hygiene, class identity, and personal branding all in one. Number 9. Enemas. Next on the list, enemas. In medieval Europe, enemas were considered essential treatments for a wide range of conditions. The earliest enemas were delivered through a tube attached to an animal bladder. This balloon-like bladder was squeezed by hand to pump liquid directly into the patient. Eventually, a dedicated tool called a clester made the process a bit more controlled, but not necessarily more pleasant. The most common mixture used was salt water, believed to cleanse impurities, relieve constipation, and disinfect the digestive tract. But medieval healers didn't stop there. Herbal mixtures using rosemary, wormwood, chamomile, or marshmallow root were popular variations. These concoctions were sometimes mixed with wine instead of water, both because wine was thought to improve the medicinal effect, and frankly, because it made the experience slightly more enjoyable for the patient. For those who needed more aggressive treatment, healers administered enemas using pure vinegar or wine, which were thought to purge rotten humors or cleanse internal decay. Other patients received enemas made from olive oil, goose fat, or other animal fats to lubricate the intestines and soften hardened stool. Some of the most unusual enemas involved broth or milk. These were intended for weakened patients who needed nourishment. The logic was close, just tragically flawed. Imagine a doctor today offering you chicken soup but not by mouth. Number 8. Incision and drainage. Here is where things start to get darker. If you developed a boil, abscess, or any concerning swelling during medieval times, your local doctor would likely direct you to a barber surgeon. The bright red, white, and blue of the barber pole originally symbolized the blood, bandages, and veins associated with surgical procedure. Barbers weren't just cutting hair, they were cutting flesh. For boils, the barber surgeon looked for swelling, redness, pain, or pus. Any of these signs meant the boil was ripe for incision. The idea was that by releasing pressure early, you prevented the infection from spreading deeper into the body. In the case of abscesses, the surgeon checked for heat, tenderness, and inflammation. If the spot felt angry, it was cut open. Since sterilization was not part of medieval medicine, these procedures often caused more harm than good. Unclean blades spread infections that could lead to sepsis, gangrene, or death. A patient seeking relief from a swollen boil might walk away or be carried away with a much more serious condition. Number 7. Broken bones. When it came to mending broken bones, medieval practitioners used the most reliable method they had, eyeballing it. Without x-rays, training, or sophisticated tools, the barber surgeon relied on sense of touch. He squeezed, pressed, and manipulated the broken limb before making a judgment call. If it felt broken, then it was broken. First, the bones were manually repositioned as closely as possible. The limb was then bound to wooden splints to immobilize it. About 2 weeks later, the patient would return to have a cast applied. This cast was made from cloth soaked in wax, wet flour, or clay, which hardened as it dried. Around the 10-week mark, the cast was removed. If all went well, the bone healed straight. But going well wasn't typical. Crooked bones, lifelong disabilities, misaligned limbs, and chronic pain were extremely common. Someone with broken legs could even heal at different lengths, leaving them permanently shorter in one leg. A medieval short king not by choice, but by poor medical fortune. Number 6. Bloodletting. Bloodletting was one of the most common treatments in medieval medicine. Doctors and barbers believed that illness was caused by an excess of bad blood. The cure was simple: remove it. Patients were bled by making a small incision or by applying leeches to the skin. The worse the illness, the more blood was drained. If symptoms didn't improve, the conclusion was not that the method was flawed, it was simply that not enough blood had been removed. Having too much blood was also considered a medical problem. Symptoms of excess blood included flushed face, headaches, dizziness, inflammation, bleeding gums, nosebleeds, fever, a bad mood. Yes, even irritability could get you blood. Barbers targeted specific locations based on charts indicating where blood should be drawn to treat each condition. Wealthy individuals sometimes paid to have leeches applied at home. Many found the process relaxing, a dangerously relaxing experience, since some people fell asleep and awoke weak from unintended blood loss. Number 5. Cauterization. Cauterization was one of the most brutal procedures a medieval patient could experience. When someone arrived at a barber-surgeon's shop with a serious wound, heavy bleeding or severe injury, the solution was often a red-hot iron. The barber heated metal tools until they glowed, then pressed them directly onto the open wound. The intense heat burned the tissue, sealing the blood vessels and forming a hardened crust, meant to stop bleeding. The goal was simple: prevent the patient from bleeding to death. The reality was far more terrifying. The pain was indescribable. Because anesthesia did not exist, patients endured the agony fully awake. Many passed out from shock mid-procedure. Some never woke up. The overwhelming trauma on the body caused a number of patients to die not from their original injury, but from the cauterization itself. Cauterization was used on battlefield wounds, deep cuts, surgical incisions, and even hemorrhoids. Yes, hemorrhoids were sometimes treated with burning metal applied to sensitive areas. This alone is enough to appreciate the gift of modern medicine. Number 4. Tooth extraction. Tooth extraction was another common gruesome procedure performed by barber surgeons. Surprisingly, medieval people had fewer cavities than many modern people do, largely because sugar was rare and expensive. Nobles who enjoyed sweets were more likely to develop tooth decay than peasants. Meanwhile, peasants cracked their teeth on stale, rock-hard bread. Bread was often so tough that biting into it could chip a tooth. Sometimes small pieces of millstone, tiny bits of stone ground into the flour, found their way into dough, cracking teeth even further. Tooth infections were sometimes believed to be caused by toothworm. To drive these imaginary creatures out, people tried remedies like holding their head over open flames, inhaling smoke, or applying heated metal to the tooth, which caused more harm than relief. When home remedies failed, they visited the barber. Mild pain might be treated with an herbal mixture of garlic, vinegar, sage, and wine, rubbed externally on the jaw, doing absolutely nothing except making the patient smell like raw chicken marinade. Severe pain meant immediate extraction. The barber used a pelican-shaped tool or plier-like instrument to yank the tooth out in one violent pull. The goal was to remove the tooth before the patient fainted. Success varied. Once the tooth was out, a hot iron was jammed into the mouth to cauterize the wound. Many patients fainted during this moment. Some died from shock, blood loss, or the infection that followed. Tooth pain in medieval Europe wasn't just misery, it was a gamble with your life. Number 3. Cataract surgery. Couching. Couching, the medieval method for treating cataracts, is one of the most horrifying medical procedures ever practiced. Unlike modern surgery, where a cloudy lens is removed and replaced, medieval practitioners simply pushed the cloudy lens out of the way. Here's how it worked. The patient was strapped down tightly since the process was agonizing and required absolute stillness. The barber held the patient's eye open with one hand. With the other, he inserted a long, sharp needle directly through the eye. The goal was to shove the cloudy lens deeper into the eyeball so that light could pass again. Nothing was removed, nothing was cleaned, and nothing was numb. Most people suffered severe infections afterward. Many went blind. Only 10–20% regained any partial vision at all, and even then it was blurry and temporary. Tools weren't sanitized, hands weren't washed, and the procedure itself permanently damaged the eye. Comparing this to modern cataract removal, which takes 10 to 20 minutes, uses numbing drops, and replaces the lens with a clear artificial one, shows just how far medical science has come. Number 2. Trepanation. Trepanation is the surgical drilling of holes into the skull. It was practiced in the medieval world for reasons ranging from spiritual to medical. If someone suffered from seizures, hallucinations, insanity, migraines, paralysis, or even erratic behavior, a hole in the head was considered a valid treatment. Healers believed this released pressure, restored balance, or let evil spirits escape. The process began with a tool resembling an arrowhead or chisel. The barber placed the sharp tip against the skull and rotated it rapidly between his palms, grinding through bone. No anesthetic, no sterilization, just raw, unfiltered agony. The procedure often took hours. In some cases, multiple holes were drilled. Afterward, patients faced months of recovery, enduring an open wound on their skull that took nearly a year to fully heal. Many didn't survive that long. Infection, blood loss, or trauma often killed the patient shortly after the procedure. The shocking part, trepanation, was sometimes seen as routine, and was one of the earliest forms of neurosurgery known to human history. Number 1. Amputations. Amputations were the deadliest procedure of the medieval era. Soldiers with mangled limbs, or patients suffering from severe infections and gangrene, were brought to the barber surgeon for last resort treatment. Speed was the surgeon's greatest weapon because the slower the cut, the higher the chance the patient would die from shock. Here's how the process unfolded. The patient was restrained with ropes, or held down by assistants. A tourniquet was tied above the limb to slow the bleeding. Then the surgeon began the speed run. He used a knife to slice through the skin and muscle as quickly as possible. Once the bone was exposed, he switched to a bone saw, or in emergencies a chisel, or after the limb was removed, it was tossed aside, often landing in a pile of other discarded limbs near the workstation. To finish, the stump was cauterized using a hot iron to seal the blood vessels. The wound was wrapped in bandages, soaked in wine or herbs, and the patient was sent home. Most did not survive long after. Infection was nearly inevitable. Amputations were not just operations, they were ordeals. Surviving one meant enduring unimaginable pain, and weeks of dangerous recovery with little hope of cleanliness or medical care. Final thoughts. Understanding medieval medicine is a powerful reminder of how fortunate we are today. Modern hospitals can remove a knife from your thigh with precision, sterile tools, and pain management. Meanwhile, medieval barbers would have cut around your flesh with another knife, pried the blade out, and hoped the wound didn't get infected. We are unbelievably lucky to live in the age of antiseptics,